Let's talk about COVID-19. Some new cases going down in some of our central Indiana counties, but they're starting to go up in others. Samantha Johnson is live this morning, keeping an eye on those numbers across the state. Good morning, Samantha.
Yeah, good morning, guys. When we talk about new cases per 10,000 people, just a month ago, we were seeing those highest case numbers in places like Monroe County and Hamilton County. Those cases there now, though, are going down, and we're starting to see more cases pop up in places like Shelby County and Henry County. Shelby County, by the way, now has the highest number of new cases per 10,000 people in all of central Indiana. So you can see that darker yellow on the state's metrics map here in Shelby County, but the bulk of that is actually to the south of us in southern Indiana near the Evansville area. But if you flip this map and actually show the average number of new weekly cases, that is right here at home. Marion County is reporting the highest number by far. Right now, right around 175 new COVID-19 cases reported every week. Now, the good news is hospitalization rates are significantly down from this time last year. In early June, we were seeing about an average of 70 hospital admissions a day. That was down to just about 18 at the end of last week. So that's the good news. But of course, we will continue to keep an eye on these numbers and trends, especially as we get closer to back to school. And by the way, you can always check the latest COVID numbers where you live under the coronavirus tab at WTHR.com. Guys.
All right, Sam, thank you. And new data from the CDC shows about a third of the U.S. is now living in a county with a high COVID community level. And that means the agency is now recommending once again those indoor masks. So Johns Hopkins University says there have been 108,000 new cases reported each day over the past 2 weeks. So that is up about 6% from the prior 2 weeks. Health experts warned that data on the rise in COVID cases may not even tell the full story, and that's because of the widespread use of at-home test kits.
On the honor system, if you test positive, you don't show up. And so that's not showing up in the data. So there's certainly more out there.
So the two Omicron subvariants that the CDC cites as the cause of the surge may partially escape the immunity produced by COVID-19 cases and prior infections. But experts do say the current vaccines and boosters do provide some protection against the severe disease.